Last class, spinal or vertebral column. In the last class, we have discussed about the cervical spine. We have talked about the axial skeletal system, what are the different components that forms the axial skeletal system. We have talked about skull, spinal column, rib cage, sternum. Then we have talked about the spinal column. In the last class, we have talked about cervical spine. If you go through your notes once again, how many cervical spine we have? So C7, as we have discussed, cervical 7. Yes, this is the smallest vertebra in the body, which has maximum mobility but less stability. That's why most prone to injuries. We have talked about the forward-headed neck posture, text neck, exercises, what are the different postures, the restorative postures which you can use to reduce this problem and maintain the healthy and happy neck. So today we are going to a little bit more further the next component of the spinal column. So the next component of the spinal column so again spinal or vertebral column. So after cervical, the next is your thoracic spine. So thoracic, if I am talking about the thoracic spine, these are 12 in number. So that's why we denote T12. T for thoracic, 12 is the number of thoracic spine. This is more bigger than the cervical spine. So this component, the thoracic, has also a natural curve, right, that we call the kyphosis. The natural curve to the thoracic spine is the kyphotic curve. But nowadays, that hunching which we are looking for the patients in the clients, this is happening, this hunching, because we are working on this forward plane. We are working on the anterior plane more in our daily life. So problem that happens that sometimes we forgot how to aware about these muscles around your shoulder blades. So if we go through the skeletal system now, and if we look at here, that the thoracic spine, thoracic 12. On that day we have discussed about the cervical, that is your 7. We have talked about 1, 2, 3, 4, 5, 6, 7. So cervical ends here. 1, 2, 3, 4, 5, 6, 7. So cervical ends here. This is the C7. Then if you look at here now, this is the bigger. This is bigger than the cervical. So this is the T1. From there the thoracic starts. T1. Then T2, then T3, T4, T5, T6, T7. So guys, T7, these are the shoulder blades, right? On the sides we have shoulder blades. So shoulder blade is like a triangle shaped bone. Which type of bone it is? Triangular in shape. So at the base of the triangle, if we look at here, this is the base of the tip of the triangle. If you make a one line towards the center, and we found the T7 here. So T1, T2, T3, T4, T5, T6, T7. So if I'm going from the base to the center, you find the T7. Then T8, T9, T10, T11, T12. So T12 is this one. So this is the part, it is the 1, this is the 12. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So you can see how much this is the thoracic spine. It creates a maximum space here in your spinal column. Right? The maximum space on your spinal column has been absorbed, has been gained by your thoracic spine. The number is T12. So thoracic, 12 we have. So in the base or the tip of the triangle of your scapula, the shoulder blade, we found the T7. So thoracic 7, T12 completely. Right? So after the T12, the problem that occurs so thoracic spine T12. Now the question arises, one more question is there, how many ribs we have? Any idea do you have, guys? How many ribs we have in our body? So 12 pair of ribs, right? How many? 12 pairs of ribs we have. So 12 pairs of ribs, and how many thoracic is T12? So each pair of ribs, this is one vertebra, suppose T1. So each pair of ribs attached to the one thoracic spine. Right? Each pair of ribs, each single pair of ribs attached with one thoracic spine. That's why the 12 pairs of ribs and 12 thoracic spine. As we have discussed, this is suppose the scapula here, this is the scapula here. So on the base, on the tip of the triangle, if you see, on the tip of the triangle, if you make a one line to the center, here we found T7. So scapula, that is your shoulder blade. If you go through the tip of the triangle, where the tip of the triangle of the scapula bone, if you go through the center line, we found T7. So here you can see once again that each pair of ribs, right? Each pair of ribs attached to the one thoracic spine. If you look at from the front, this one you see that this pair of ribs is going here, 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 attaches to the thoracic. Thoracic, 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 thoracic. And this is the last pair of ribs. If you see the last pair of ribs attached to the T12 here, right? The last pair of ribs attached to the thoracic 12. So that's why we say that each single pair of rib attached to the one thoracic spine. So 12 thoracic, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And 12 pairs of ribs we have. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and this is the 1. So 12 thoracic spine, 12 pairs of ribs. Now the problem that happens, the main problem that occurs with the thing like imbalances, right? The imbalances of this postural deviation. What are the common imbalances which we can see on the thoracic spine? So many common imbalances are there. The main postural problem that occurs, the postural imbalance on the thoracic spine. The people say kyphosis, right? The kyphotic curve. Yes, we need. It doesn't mean you don't need a natural curve. As we say, the spine has S-shaped curve, right? The spinal column, S-shaped curve. So, this is the S-shaped spinal curve, right? So from thoracic, suppose here is the thoracic, lumbar, sacrum, cervical spine. As we say normally, we have 4 natural curves on the spine. So cervical, thoracic. So this thoracic curve gets more increased when it increases in its convexity. What happens? This happens that hunchback, right? We call it hyperkyphosis. What we call it? Hyperkyphosis. Or we call it hunchback. So with this hunchback, challenging is the heart opening. Which kind of poses you find challenges? Backward bending, because the posture is that, right? The muscle around this area, the muscle around the shoulder blades get over lengthened, weak. The muscle memory in the brain, zero. So these muscles around this area gets no awakening, weakens. It get weakened more. The front part of the muscle in this posture, what happens? Overly tight, the pectorals. Right? The front part of your chest muscles get overly tight, over-engaged. And the back muscles get weak. So that problem happens. So now as you try to go for the backward bending, your shoulders, your hunchback is here. So you try to press your lower back. You try to throw your lower back. There is no opening from your front part of your chest muscles. Right? No opening from the front part of your chest muscles. So we have so many things that the restorative way, if you are working on a laptop, computer, on the desk job. So balance needed, guys, that we have to make some muscle memory here also in these muscles, that we have to activate the muscles around your shoulder blades. And we have to stretch the muscle from the front part of your chest. This is the goal. And then you can do it very simply also. So back bends. It's a challenge here. Challenging. So backward bending is challenging when you have a hyperkyphosis or hunchback. As if some person asks you to lift your shoulders up, this happens. So simple way you can do, like if we ask, just every day just take a quick break from your work after 30 minutes, 40 minutes and try to this opening of the chest. Is it simple for you or not? Do you have 2 to 3 minutes? After 1 hour, 3 or 30 minutes, you can do this. So when you can engage the muscles, just nothing to do. Bring your hands back, open the chest. Right? This one you can do. Or simply you can do that you can sit on your chair, bring your hands on the back of your head and open. Make sure lower back has not to be go like this is wrong. Back has to be in control, right? The lower back has to be in control. So just do like this. Or you can support like this way on your lower back or on the mid back and open like this. This you can do, bring your hands on the back of your chair and just open your chest like this way. So this also you can do to prevent your hunchback or prevent the weakening of the muscles around your shoulder blades. This simple exercises you can add with the chair, with your own body too. Simply you can stand, interlace your fingers like this way until you can go in wet range. You just do that way. Don't drop your lower back, control your pelvis and open your shoulders as much as you can do. So starting with the initial level, no problem, then slowly you can increase. So you can feel something, burning sensation around your shoulder blades that the muscle is getting active now. Nothing you have, just as you go back to your home, just use the block. Right? Use the block. The basic level you can use the block in between your thoracic spine at the level of T7, where we have discussed that base of the scapula. Right? That we can use. First, in the beginning level, use the block like this way. This is the shape of the block. Not like this. This is the advanced level a little bit. It has to be like this. And we lay down on the block at the level of T7. You can place your hands on the side, open. neck relaxed, shoulder relaxed. So what is happening here now, if you look at from the front part of my chest, as I'm taking this way, you find that a good shoulder opening and the chest opening, and I can feel the muscle around my shoulder blades. It is engaging now, and I'm stretching my overused muscles from the front part of my chest. So this way you can do, guys, also, right? Now come back from the posture, go towards your side, take a support, come back. Next way we can do, as you feel that I'm getting more range of motion now, my range is increasing, I feel more relaxed, I can go, then you can use this level, right? It also has to be in between your shoulder blades. You have to place it here like this way. From T1 to T7, or maybe sometime T2 to T8 to T10, where you feel the comfortable zone for yourself. So this is we call the T-block placement. If this hurts you, you use the cushion or use the pillow, right? So after that, you can use this also, same way. On the T7, we are going here now, and just what we have to do, open the arms on the side, open the shoulders. So this is the restorative pose. If you want to engage, or if you want to do hip opening from here also, just I'm going to settle it a little bit upward. If you want to go for the hip opening, this is the restorative pose for you. Shoulders you can open more if you want. This modification also you can do if you want to get more shoulder opening, hip opening, chest opening. So all the benefits you can gain from this pose. Right? Then we can use the T-block placement also. The T-block placement we say, like this is here on your thoracic spine, and this is on your neck. So the body is going like this way, right? This one and this one. So don't drop your neck. If you're dropping your neck, again the compression comes to your back of the neck. So here we can go. This is the way to go, and this is the way. So T-block placement you can do. You can stay here for 3 to 5 minutes, 2 minutes, depends upon your comfortable zone. So this way you can use the T-block placement. So you have so many ways to open your chest or open your shoulders. The simple way you can do, just try to bring your hands here. When you're sitting on the floor, just use the cushion underneath your sits bone, so you can feel the higher level of center of gravity here too. Simple way, if I told you guys that, you can use it here now, this hand placement, rather to do this, just externally rotate your shoulders. So like this, and try to bring your palms down and lengthen your neck up. Close your eyes for a while, open your chest. And you can feel that these muscles are getting open. So this is the only correction in the pose. Correction in the position, how we are sitting, how we are standing. Here we can use simple stretch again, which we have discussed on the chair. In the sitting also you can do it. Opening, opening is simple. Like a butterfly. Just fly like this way, open on the side, chest muscles, external rotation. Bring your shoulders back, open your chest, ribs soft, spine long. So these are the benefits that we can gain from where we say we can gain from the thoracic spine, like we have to bring the thoracic into the natural curve, right? Bring it back to the natural curve. That's what we needed. Balancing on the muscles. What we needed? Balancing on the muscles. It's not about only just with the hunchback. People ask you to open your chest. What happens? People try to do this. There is jamming on the muscles. Since 1 year, 2 year, 3 years, no awareness on the muscles. After some time, muscle wasting starts. That we call the atrophy. Muscle atrophy. Then after some time, muscle forgot how to make the muscle memory in your brain. That's why it takes a long time to activate your muscle memory in the brain. So that's why, guys, the main focus, that on the thoracic spine. If you have a bolster, you can use the bolster too. You can use the bolster that we use with the, mostly with the beginners or with old age patients or old age clients. So here we are using the bolster. So we place the bolster like this way. If you want to use that, this you can use, and if you have a neck flexibility good, you can avoid it, or you can use that cushion in place of your block, so that we can avoid the compression from the neck. So we have to sit on the edge of the bolster, right? Where we have to sit? We have to sit on the edge of the bolster and just lay down, lay down, lay down. And here we go, hands on the side, and this is the restorative. So if you're going for the backward bending, right, with the beginners or with the old age students, preparation, all the stretches are the preparation which we have discussed right now to avoid the injuries on the lower back, on your hip joint, on your tailbone, and on your cervical spine. So open the chest, because we need movement from the thoracic spine, not from the lumbar, and not over movement from the hip joint, and not over movement from the cervical spine. So this way we can do easily. So this is the preparation for backward bending and the stretches which helps you to recover from the hyperkyphosis or the hunchback. Then turn around the side and come back to the sitting position. This way also you can use the bolster if you have problem that the block has too much height. This you can use the bolster like this way. Here my lower back touch towards the bolster. I am on the thoracic spine now, and check my neck alignment is okay. I am maintaining natural curve on the neck and taking my hands on the side. So 3 to 5 minutes you can hold this position, and you can feel when you are laying down like this, you can feel the back muscle activation here and stretching to your front part of the chest, and no extra pressure on your neck and shoulder. Relax on the side. Then take a turn around and come to the sitting position. So guys, so many modifications we have, right? Preparation is must needed, right? The preparation is must needed before the presentation. Whenever you're preparing for anything, you present yourself. Preparation, if you want to present something, you prepare so many things. Oh, I have to collect this slide, I have to collect that data, this and that. Same thing with the postures, right? Same thing with the posture. That's why the yoga anatomy we introduced here, and where we are giving you so many modifications that if you know about the imbalances, that's why in the first class of the alignment, I talked with you guys that we don't have to learn the alignment. Alignment we know. We have to learn the misalignment so that we can realign people easily. And that how we can do? If we have a good knowledge about the body. If it doesn't know about the thoracic spine, how I can adjust, how many it is. Maybe I am forcing it too much. If I don't know what it is for stability or mobility. How much weight bearing is happening on your spine at the thoracic level. So these are the bits and pieces which we have to get together, and collectively we have to give a healing effect, right? A healthy effect to the spine, that the spine becomes more strong, more flexible, and then there will be no injuries. As the people say, you are as much as young, as much as flexible your spine is. If you are in 30s and your spine is not moving in all the direction, in the forward flexion, backward extension, side flexion, twisting, if it is not moving, for me, you are in 60s. You have seen some people who is in 60s, 70s, and their spine is moving in all the direction smoothly, good range of motion. For me, they are in sweet 16. So choice is yours, guys. Maybe you have a good spine, but the person is around you. As I already told you, a good teacher is not that who knows how to make themselves flexible. A good teacher is that who knows how to make everyone flexible. So yoga is not only for your own flexibility, because you know your body. If you want to become a good teacher, you have to make everyone flexible, guys. So that you know that I know about the different types of bodies. I can deal with them. I have so many variations for them. So that way we have to proceed. That's why we are giving more detail into the yoga anatomy. More modifications, more variations. So you have each and every dish in your plate that you can serve according to the taste of your student. So that's why focus is on individual alignment. And when we can learn the individual alignment? When we know about the different imbalances. So don't always run about the alignment. If you know about the misalignment, you can realign your student and you can make a new alignment for your student. That is the goal of teacher training. So here we have discussed about the thoracic spine, right? T12. Then we have 12 pairs of ribs. Each one pair of rib attached to one thoracic spine. Is it? Then we have talked about the hyperkyphosis. Hyperkyphosis, hunchback, when the kyphotic curve gets more increased into the convexity. Problem comes when there is a hunchback, problem comes to the back bends. Back bends become more challenging. So spine has a natural S-shaped curve. Try to maintain this curve. Try to maintain a good ideal posture. Yeah, it's sometimes hard, difficult that every time we cannot stand like a mountain. But as you're going for like this, after some time, bring the awareness, open your chest. So just make the muscle memory in the brain, and we need only the awareness on the each and every component of the spinal column. So I hope this must be clear to you. The thoracic T12, hyperkyphosis, hunchback, back bend is challenging, S-shaped natural curve on your spinal column. So try to maintain your normal spinal curve. When you get time, take a little pause, check your cervical, check your thoracic, and take care of it. Any questions, any queries in relation to thoracic, cervical, you are most welcome to share with me. We can